Hello, class. Welcome to week 6. We're moving right along. You have a lot going on this week. I believe you have a test, a vignette, and a discussion board. So there's a lot to be done. I apologize for so much in 1 week. Week 7 will be my last live lecture. Week 8, I need to double check. I don't think there's a discussion board, but if there is, I will take that off as something to do because week 8, you guys have a lot to do for all of your classes. So I will make sure that won't be one of the things that you have to do. I'll write down in the announcement some extra credit opportunities, but usually I think now the school sends you a survey for you to fill out automatically. It's your choice to fill it out. I won't know what you say personally. I'll be able to tell if you take it, and if you decide to take it, which is your choice, it's 10 extra credit points. So that's an option, and then I'll give an option too for a missed discussion board. You guys have been doing really well. I wanted to touch really quick. I've been obviously I record these lectures, and I'm reading all your vignettes from week 4, which have been great. And we're talking about Ashley. And just really quick, Ashley's situation is it's a terrible mistake, right? And from an outside perspective, it's really easy to be critical of Ashley, but it's so easy for it to happen, especially when you're new and they're trying to remember so many things, and maybe the client comes in and immediately starts talking and you don't even know what to do. Like, you just sit there and they just start talking, and then like Marcy discloses all this information and she's like, oh crap, I forgot my informed consent. Okay. Yes, that's a problem, and it's not right, and it's not good, and it's a very sticky situation that Ashley got herself in. But I wanted to just add the human factor of, like, it is possible. So if this does happen to you, that you don't think the worst of yourself. And that's why supervision is so important. We're going to talk about supervision today. But I just wanted to kind of just say that because I've been there. I've probably done that and then I've had to backtrack. So it's possible, okay? And I think in a lot of these situations that we have discussed thus far, a lot of the intent has never been to harm, but the decisions have led to harmful things, okay? So we're talking about competence, and it is so important when you're practicing that you're not saying that you can do more than what you can. So you need to make sure you're practicing within what you've been trained in, what you're educated in, what your supervisor allow you to do when your proper credentials, right? You're not prescribing medication. You're not advising on medication in the sense of recommending things. We won't even recommend essential oils because you don't know if Susie Q, sorry, that's my lame example always, but you don't know if Susie Q is allergic to lavender. So we're not going to suggest it. So we need to stay within our scope of practice, and that's really important. Don't say you're trained in EFT and you're not trained in EFT. You may have taken a class that talks about EFT, but if you haven't gotten the proper certification, don't say that you haven't. Okay, that's dishonest, and that would make you not competent, and you could be harmful to clients. And there's some therapeutic things that require special training, and it could be harmful if you didn't do it correctly, like EMDR, things of that nature. Upgrading skills. So work with colleagues or professionals who have more experience than you, seek consultation, learn new skills by attending conferences. There is tons of CEUs that can help develop you. And granted, it's a marketing, it's business, but there's a lot of things out there that give you a special certification in something. I mentioned EFT. There's things now with different kinds of tapping things, relaxation techniques. So if you want to grow in that area, by all means, go pay for the class, do it. You'll get credit for it for CEUs. You'll be able to add that to your resume, or to add that to how you advertise yourself, but don't do it before you have the proper channels, right? And even if you go and do those classes, if you're still under supervision and your supervisor doesn't feel comfortable with you doing those things, even with a special certification, you still may not be able to practice it because you're under someone else's supervision, which is underneath their license, which is really a gift to be under someone else's license because they're putting their license on the line for you. So just making that point as a person who has my own personal associates, who supervises associates and trainees, just be mindful of that. Okay, so we may need to refer a client, and you want to make sure wherever you work, especially as a trainee or associate, that they have a great referral list. So make sure that there's a toolbox for you full of all kinds of tools, right? And so there should be community resources. There should be other therapists you can refer to, maybe even psychological type hospitals, psychiatric care, places for maybe low income medication, stuff like that. That should be a place. So you need to make sure wherever you start working that you ask where those things are located. If you are in the Riverside County area, this is a number to remember. It's 211. And that is a number that you can call, and they will tell you of all kinds of mental health resources in Riverside County. And Riverside County is pretty huge. So just remember that. I believe it should still be up and running even in the midst of the pandemic. As we know, mental health has been in a bit of a crisis over this last season. So yeah, that's just a resource for you. You might be referring a client because of a conflict with your value system is not ethically acceptable reason for referral. Remember that. We've talked about that. You can't refer someone because you don't agree with their life choices or their religious practices or their sexual preference. You can't do that. So you have to work through those things, which is good. I think good for you professionally. It can be very good for your client. I even had a client or a therapist work through, I think there might have been some racial concerns that the client had towards my therapist, and she pushed through it. Sometimes it can even be that way with gender, and there can be a way to push through that and it be really good for the client and for yourself. Consider referral as a final intervention after you have exhausted all other interventions, including consulting. Okay. We even talked about that with sexual attraction, right? Or, well, it sounds so hard. I don't know. With attraction, I don't want to say sexual attraction. With attraction, you just want to be mindful of yourself, how you're acting, even if you're attracted to one of your clients. You need to be professional, not acting different, not making sure you're wearing certain clothes for when that person is there, all those kinds of things. It's human to be attracted to people, but what we do with that is really important as a client, or as a clinician, I'm sorry. Ethical issues in training therapists. So, okay, making sure, like again, with your school, right? You're going over all the proper criteria. You have been exposed to all the major theories, right? You have theories in counseling. You guys have family therapy 1 and family therapy 2. You guys have all the classes required that are required to become an associate and hopefully a licensed marriage family therapist or a licensed professional counselor. Understanding the theory, and again, you should be getting some sort of personal learning in that process. So we want to make sure as professors that we are making sure that we have competent practitioners that we're sending out into the world with CVU's name on it. And we are wanting you guys to be diverse and be aware of ethical things and legal things, because again, you're representing not only yourself, but the institution and where you got your education. And again, we're getting to see you guys in a different way than maybe a supervisor would at a site. And so if we have concerns too, we need to be willing to speak them out to you, because again, this is like a heavy field. It's important that you as students are capable and trustworthy and competent to have a caseload of clients. And we are kind of, we see you first. And so, we want to make sure we're sending out quality and not just quantity. That's not our goal. And so, that is something that the role of your professors and whoever's in charge of you of practicum have, okay? And your supervisors at your practicum sites. Like I said, honesty, integrity, emotional and mental stability, evidenced by the presence of personality adjustment, absence of psychological disorder, and appropriate use of substances. Okay, so, and when I say absence of psychological disorder, that doesn't mean that you don't struggle with anxiety or depression. It may be that you may have even bipolar disorder, or whatever it may be, a personality disorder, but like you have it under control. You are taking care of it in the proper ways, and it's not something that will inhibit you in the counseling room. Obviously, you cannot be under the influence of a substance like alcohol or drugs or prescription drugs in a way where it would make you not cognizant. So, we're not going to give our stamp of approval with someone that has a known problem of that nature. And is probably potentially exhibiting those things in class, like that would be problematic. So the academic faculty in a professional program, like I said, we are the gatekeepers. We're the ones that are sending you out there. So we're looking for these things, okay? And there can be like a conflict sometimes. When a student has good grades but demonstrates substandard interpersonal behavior indicating serious unresolved conflicts, action needs to be taken. So yeah, you might be a good student, but like maybe how you interact with people, it kind of might rub a professor the wrong way. They may talk to you about it, because that can be problematic. And I just want to be mindful of you. Be mindful, as I say this all the time, and I'll say it again, and I don't care. How you guys act in class or act towards each other. Remember, you never know who you're going to need in the future. And I myself have been in this field for some time. I think now 15, going on 15 plus years. I have needed my colleagues. I have needed former professors at different times. And luckily, because of my relationship with them, I had no problem utilizing them and them coming to my aid when needed. You never know who you're going to need, and never know who's going to be a supervisor at a job that you want. And so just be mindful how you treat your professors, how you treat your fellow students, because these are the people you're going to be working alongside in the future. And you'll realize once you're out there, the world may seem so big, but it becomes so small in some of these arenas. And so we're really meant to be, we want to work together. I always tell my students, if you need help in the future, just let me know, and I'll try to help you as best as I can with licensing questions, private practice questions. We really are here to help you and assist you in this journey, but it's so easy to get caught up and maybe speak our mind, or I don't like this, or I don't like that, and maybe be rude or short or whatever, and it maybe really could leave a bad taste in somebody's mouth. And so just be mindful of that. We can think differently, but that doesn't mean that we can't be kind to one another, okay? Again, certification and licensure, remember, those are those 3,000 hours until we become licensed. So we got to remember where we're at in the process. So you start off as a trainee. Then once you graduate and you apply, you can become an associate. And then once you have your hours done and you take your test, you then become licensed. Okay, so certification, voluntary attempt by a group to promote professional identity. Attempts to verify qualification. So if you get a certification in something, you're qualified to do that. That's the minimum standard. So like I have a certification to use EMDR, which is a form of therapy that is specialized. And so I do that in my practice, but I had to go through an extensive training and spend some money, because that's how those things work. And then a license, of course, it's governed. The state of California sets the standard, or the licensed professional counselor. It's a standard that's set nationwide. It highlights uniqueness of the occupation, and there is, of course, restrictions of the title and practice of the occupation. So there's rules and guidelines, which is why you're in this class, right? And hopefully you're learning a lot. Like I really do enjoy, I mean, it sounds so lame, but I do enjoy the textbooks that OPS picks out. I do think they're really great. So supervision, this is something that you will have for quite some time. And let me just say, as a person who's a supervisor, I love supervising. I think it's great. It's a great way to break up my day from seeing clients, because I can be a little bit more myself. in the sense of I can eat lunch with my trainees and associates, but not just because I can eat my lunch. But I just enjoy hearing cases and talking through things and concerns and supporting them in the best way that I can. And it's so great to see them licensed. I've had one person I've been with for a long time, and she's now licensed and actually shares my office space with me, and it's been really cool to watch her journey. Okay, so the goals of supervision are to promote growth and development for the supervisee, to protect the client, to monitor the performance of the supervisee, to empower the supervisee and support them, okay, and for them to become independent and for you to feel competent in your field. Informed consent and supervision, the standard of practice is to incorporate clear informed consent. For supervisees, it is beneficial to discuss the rights of supervisees from the beginning of the supervisee relationship, okay? I always tell to my clients when I was under, and I probably told you guys this already, but when I was working as a trainee, and I worked at the Cal Baptist Counseling Center as a trainee, but I remember telling them, my clients, I'd say, you know, hi, my name is Tony, and I'm a marriage and family therapist in training, so I'm a trainee. And as a as a marriage and family therapist trainee, I'm a mandated reporter, so you can tell me harm to self, others, elder abuse, child abuse, I have to report. Also, I'm in training, so I am under supervision, so I will talk about some of my cases. But it stays under the umbrella of this counseling center. Do you have any questions about that? So that was my spiel. That was the spiel Ashley should have given, but she didn't. So that's my spiel. And that was my spiel. Now I just say I'm licensed instead of saying training, and I don't have to give the whole thing about supervision. But that's something that you should be doing when you start seeing clients. Okay, when supervisees learn what they can expect in supervision and what to do to achieve success, they are empowered to express expectations, make decisions, and become active participants in the supervisory process. So true. I think supervision, you're going to spend a lot of time with your supervisor, depending on how your sites run it. Usually it's either group supervision, which could be possibly up to 8 people, or triadic or tridactic. I always say that wrong. I'm sorry. I always say it wrong. But it's 2 clinicians with 1 supervisor, or you could have one-on-one supervision. And depending on how many clients you see, and assuming you're a trainee, you can spend a lot of time with that person. So you want to feel free to share concerns about clients, maybe fears, you express expectations. You should even be able to talk to your supervisor about something that you feel that's problematic with them. Whatever it may be, you just want to make sure you are doing all that you can to make that relationship grow in a positive direction, but you want to feel comfortable to be who you are, because the supervisor should not be so critical of you where you feel like you shut down. That's not healthy. They should be an encouraging person to you as well. You shouldn't be afraid of your supervisor. That's not the nature of who they are. Now, there can be some supervisors that are intimidating for whatever reason, but usually when you get them one-on-one, they're not that intimidating. We've all been in your shoes, and we shouldn't forget that, right? So the following topics should be included in supervision: supervisor's background, methods to be used in supervision, responsibilities and requirements of supervisors, supervisor's responsibility, policies pertaining to confidentiality and privacy. You will sign paperwork when you begin with your supervisor. So you want to make sure you have that all printed out. We have like learning contracts. These are things that you're going to go over in practicum for sure when you get there, but there will be a process with paperwork and whatnot. You'll have your supervisor will be signing weekly hours for you, just signing off that you completed them, and that is something you're going to need when you apply for your associate number. Also, you will need that when you're applying for licensure for the continued supervision that you have. So the rights of the supervisee, you have rights, of course, right? So you should be with your supervisor free from distractions, be fully informed of supervisor's approach, confidentiality with regards to supervisee's disclosure. And sometimes in supervision, at least in my supervision, I have some of my associates and trainees open up about personal things that they have going on in their lives. And so, of course, I wouldn't share that with anybody else. It's none of their business. But that stuff you want to make sure stays private, and you feel comfortable and trust your supervisor to share some of those things. And then confidentially with regard to clients' except as mandated by law, right? Which harm to self, others, elder abuse, and child abuse. Our clients should, or I mean, our associates or trainees should be mandated reporting that, as well as, you know, if something came up in supervision, your supervisor's gonna have to report, or your supervisor may even encourage you or walk with you through a report that you have to make, or advise you, you know what, that was reportable, we're gonna need to report it, which are hard situations, but that's what supervision for, okay? So access to records, to provide feedback to supervisors considering supervision experience, which I would love to hear from my people what they think of supervision, and to seek consultation from other professionals as necessary. Responsibilities of a supervisee: come prepared to supervision, be an active participant. You're a bump on the log if you don't participate. Now, there's some reasons, sometimes there's certain groups where it doesn't feel comfortable because of maybe group dynamics, which once you take group class, you'll understand that a little bit more. I just taught groups. I feel like when I was about to say that, I was assuming I'm having all the same students, which I don't have all the same students, but there are group dynamics, even in a group of professionals who are in the same field. So some people might cause you to shut down or whatever. Talk to your supervisor about that so they can change something up with the group. Just come prepared to supervision. Like, it's part of your job. We want you to be engaged. We want you to be ready. We want you to hear about the things that are going on. We want to celebrate your triumphs. We want to work with you with hard things that are going on. It's a collaborative effort. And if you're not collaborating, then it makes it difficult, okay? So just come prepared. Ask for feedback, okay? Ask your supervisor, how am I doing? You want to just make sure, again, healthy boundaries. There shouldn't be anything that's confusing or strange that's happening between you and the supervisor. It should be constructive and not just critical. And so you want to be able to talk to them about that, okay? If you're overwhelmed, you guys are going to still be in school when you start seeing clients. So letting them know if you're too overwhelmed, you have too much on your plate. If you're having any sort of counter transference with clients, you need to talk to your supervisor about that so you can work through it together, okay? Supervisors must be competent both in practice of supervision and in the area of counseling, right? Should provide supervision only after obtaining, so you have to be licensed for 2 years before you can become a supervisor. And in that, you have to take a CEU to pass to be able to be a supervisor. And so you want to make sure that your supervisor has done that. We are responsible for both ethical and legally for the actions of their trainees. So, hey, it's a big deal that we're taking you on, right? Supervisors have responsibility to supervise current and future clients. And supervisors must have a clearly developed framework for supervision and a rationale for the methods they employ. So self-report is one of the most widely used supervisory methods, yet it may be the least useful. Process notes build on the self-report by adding a written record explaining the content of the session and interactional process. Audio recording is widely used procedure that yields direct and useful information about the supervisee. Video recording allows an assessment. Most of my experience in counseling and in the growth as a therapist has been using video. Video is super helpful. It can be very intimidating, but it is super helpful just to be able to see body language. And it's not to be focused on your client. It's more focused on you and how you're interacting. Now, your client has to agree to be videoed. However, I think it's very, very useful. Okay, so we're going to stop here, but I just wanted, again, like the supervisory, supervision, supervisee relationship is really, can be a very beautiful relationship, very helpful, very rememberable, just in the sense of like, this is the person that walked through with you at the beginning. It's been a very positive experience as a trainee, associate, and then being a supervisor. I've had a very positive experience. So I hope for you guys that you are able to experience that. And if you're not feeling comfortable with your supervisor, you need to talk about it, because there might be another supervisor that's just a better connection or a better fit for you. At a lot of sites, you have different options. Like there's more than one. And so you might have one for individual, one for group, which it's kind of nice to have different people because they come at things from different perspectives. And that's great because then you're learning from different people. But not every site has that. And so you do have the right to speak up if something's uncomfortable. Tell your practicum teacher, professor, because they can help work through that with you, because we have some responsibility as a university to protect you as well when you're in practicum. So I don't want you to be afraid to speak up either. I hope you guys are having a great week and staying healthy and safe. We're almost done, and then the next session starts, but we're almost there. So hang in there. Week 7's next, and then we're at the end. So I'll see you all soon.